Thank you so much. It's wonderful to see so many of you committed to walking and to making our communities walkable, and to see so many friends and colleagues that's interested in this quest, especially since you all know that exercise is medicine, and girls are trekking, and America walks, and other organizations. So I don't really have anything new to tell you because you are the experts. However, I'm going to reinforce it. The things you heard on that wonderful panel this morning, the more you hear it, the more it sinks in, and maybe by the time end of this meeting, you'll be brainwashed, and that's the idea. Many of you know that I'm a longtime champion of the power of prevention, and it was the foundation of my work as Surgeon General. While I left the position, I did not leave the mission. All of you have heard me say, health does not occur in the doctor's office alone or the hospitals. It also occurs where we live, where we learn, where we work, where we play, where we pray. I believe that prevention offers the greatest opportunity to improve America's health and the health of America's families now and for decades to come. I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in recent years, it's become much more relevant than ever before. It's become an imperative. And that's largely due to the changing dynamics and the demographics as more American families struggle to deal with chronic diseases and chronic illnesses such as diabetes and hypertension. And the case for focusing more of the nation's attention and resources on prevention is more than a theory. It's a reality that's grounded in science and experience. We know that with better health, children attend school more regularly and are better able to learn. And we know that with better health, adults are more productive and they work more days, except when they are furloughed. And with better health, seniors can better maintain their independence. But on the other hand, we know that the lack of prevention takes a devastating toll on patients, their families, their communities, and the workplace. And much of the illnesses and the early death that's related to chronic diseases is caused by just 4 modifiable health risk behaviors: lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. We know we can do something right away about the lack of physical activity. This year, in 2013, more than 800,000 Americans will die from heart disease, and the overall cost resulting from cardiovascular disease is estimated to be $444 billion every year. We have to make prevention part of our everyday lives and empower people to make better health choices. And as Surgeon General, I had the privilege of chairing the National Prevention Council that was established by the Affordable Care Act. And many of you know that council consisted of 17 cabinet level heads of agencies. We added 3 more just before I left, so now it's 20 agencies. The Secretary of Health, the Secretary of Transportation, Agriculture, Labor, EPA, all these secretaries sitting around for the first time to ever talk about prevention. That council released the first ever national prevention strategy. And our vision is to move our healthcare system from a focus of sickness and disease to a focus on wellness and prevention. Because if we truly want to reform healthcare in this country, we need to prevent people from getting sick in the first place. So in addition to the state-of-the-art medicine, we need a new approach to promoting prevention in our communities, since staying healthy depends on other factors that influence our health, like housing and transportation, education, the availability of affordable foods and quality foods, our workplaces and our environment. We really need to change the way we think about health in this country. And that calls for us to take a more holistic and integrative approach to community health. Everything from safe highways and worksite wellness programs to clean air and healthy foods and walkable communities. If we follow the recommendations of the National Prevention Strategy, we can prevent or at least significantly reduce the 5 leading causes of death. Although we've been trying and we've been working, we find that the biggest challenge is in lifestyle changes. But lifestyle changes can make the biggest difference. And as leaders, you can make lifestyle changes, and particularly healthy behavior, more fun. And my friends out here know I have this idea of having a healthcare journey to joy, We have to put the joy back into being healthy. Joy to the professionals, joy to the individuals. You can't underestimate the power of joy. We have to find our own joy, each of us. What brings you joy may be different from what brings me joy. One person's healthcare joy may be running a marathon. Another one may be fitting an old pair of jeans. And yet another person's joy may be just sitting up long enough to play with their grandkids in the afternoon. We have to stop telling people what they can't have, what they can't do, what they can't eat, and start to tell them what they can do. We know that they can go out for walks. They can play, they can have a good time. They can walk. So I'm going to continue that journey to joy. So I hope you'll follow me on Twitter at Regina Benjamin, yes, so we can keep that going. But we also have to go where the people are. We can't just write a report, put it in the library and expect them to go find it. We got to go where they are. Many of you know about my idea about hair and hairstyles, asking women, and particularly women, but guys have come to say the same thing is, you know, why aren't you exercising? Well, I'm not going to sweat my hair back. I just got my hair done. So we engaged the hairstylist at the largest hairstyle show in the world, 20,000 hairstylists to create a exercise-friendly hair competition. And it's really gone over well. And they will say, you know, my clients see me more than they see their doctors. And that's true. So we have to go where people are. So what we're doing with walking is going where people are, using their smartphones, the things that you're seeing here at the conference, having this walking campaign. You've seen the Fitbit, the Jawbone, the Nike, I think you saw the Tractivity, those sorts of things, starting using technology to go where people are. And this past spring, I had the privilege of commissioning the Surgeon General's call to action on walking. And that call to action is being developed with the help of many of you in this room and is on track. And hopefully you'll hear more about that a little bit later this afternoon. But today, I'm really pleased and look forward to becoming the National Honorary Chair of the Everybody Walk Collaborative.